It's a website many of us visit to get a gauge on COVID-19 activity here in our state, coronavirus.iowa.gov. It was part of a state audit to make sure Iowans are receiving the right information in a timely manner. The Iowa Department of Public Health uses that website on its own to release vital information to the public. The state auditor's office found Iowa does a good job getting the data out, but more could be done overall. So here to talk about this audit, State Auditor Rob Sand. Thanks for joining us, Rob. Let's talk a little bit about this audit. You were telling me that this is something that states across the country are doing because they're looking at these numbers. These are important numbers that we're reporting. That's
right. A lot of people, folks every day might be looking at the dashboard, they might not. But there are a lot of people who are. It could be an administrator for a long-term care facility or a nursing home. It could be a superintendent of a school district. It could be someone who's immunocompromised. And state auditors, Democrats and Republicans around the country, joined together to say, hey, let's take a look at how our states are treating this data, because in the long run, someday we will have another pandemic. And if we compare states to each other, we'll be able to say which practices are good ones and which maybe should be changed in the future.
So now when we boil down into how Iowa is reporting the numbers, collecting the data, what is the state doing right, did the audit find?
Yeah, we had good transmission of the data that was coming from Domo into the state's system. We tested that data and saw that it was coming through accurately. Another issue that a lot of people were concerned about very early on in the pandemic was, why are some of these numbers coming in late? Why is it, July, and we're now seeing these numbers for these tests performed in April? Well, we have an answer to that now because of the oversight that we performed. The answer is a lot of the private labs that were conducting these tests, that were analyzing the tests, they simply weren't equipped for a pandemic amount of volume. And so they were submitting this information to the state very late, sometimes months late, and the state was doing a pretty good job of getting it up onto the dashboard as soon as they could.
Sure, that's a simple explanation for that lag time, just the technology just trying to catch up with of the sheer amount of numbers that we had. What did you find that Iowa could be doing better when it comes to either collecting the data or disseminating the data?
One thing that we think is important is to always provide a second level of information for people who do need or want to know it. For example, we all talked a lot about positivity rates previously. Now that we have a lot of at-home tests, that information is not as important as it was. But the truth is there's a lot of different ways to calculate a positivity rating. And the state at one point changed their calculation, which really threw a lot of people into a bit of a tailspin. We went back and we checked those positivity ratings. They were accurate when the state was calculating them. But one thing we wanted to say was, why not just provide a second set of information where people can go and read which calculation that you're using, so that later on you're not surprising anyone by telling them that you're going to do it differently.
So just kind of, I don't know, you want to call it a footnote or just more of an explainer about the numbers?
Exactly. Just a click, more info here.
Sure.
And then whoever wants to click it can, and those who don't want to don't need to.
So when you're talking about just all these states across the country kind of doing a similar thing, is there some way to make everything kind of streamlined? So say what you're seeing in Missouri, the same numbers you're going to be seeing in Iowa. When we're talking about regional data, Wisconsin, I'm just thinking of all of our neighboring states.
Sure. My hope is that long term, and again, this is going to happen someday, we don't know when, but we'll move closer to best practices, where we really are able to focus in on which pieces of this data are most important, and be focused on making sure that everybody has as much information as they want. At the end of the day, we're supposed to be serving everyone, and if there are folks out there who have questions about this, it comes down to a matter of trust. That's a part of why our office exists. We go out and we investigate oftentimes very powerful entities in the state of Iowa. And what we're trying to do at the end of the day is tell Iowans the truth about what's going on. So sometimes we criticize them, and then on other occasions, like today, we tell folks it looks like they're doing a good job. But for our office and for other state auditors around the country, that's the name of the game at the end of the day, is trust and integrity and accountability.
And you're coming up with this report, this audit, and then what happens after that, it could be that something needs to change, but then that's kind of outside of your office, right?
Exactly.
So you're saying this is the information, now either make the correction or continue doing the right job.
That's right.
Work.
That's right.
Okay. Well, Rob, I know it's a 61-page audit report that a lot of people, there's a lot of numbers in that, but people who do want to read it, I know that they can go onto your website.
That's
and
right.
Take a look at it.
That's
All
right.
Thanks, Rob Sand, for being with us to talk about this latest audit of the numbers for coronavirus.org.